With DiMe, we bring together a variety of organizations around, in this case, hospital at home. And what those organizations, they go from medtech to big tech to healthcare organizations to professional associations. And they came together around the table with the shared challenge of, when we're thinking of hospital at home, we've all been able to identify clear hurdles to implementation, clear activation barriers. There is a lot of information there that we've learned over the years doing this that we can share with others to help them build their own programs and make sure that hospital at home isn't a niche event, a niche way of administering healthcare, but it becomes this broader, generally available way of administering care that is known to have many, many benefits. If you go by the CMS report, the results are in, right? Like, if we look at the hospital at home programs that have been evaluated over the last few years, they show great improvements in patient outcomes, in patient experience, which is important as well, and hopefully will go hand in hand with patient outcomes, as well as operational and cost efficiency opportunities. Even more so than traditional brick and mortar programs, there is a very high sense of needing to measure what we're doing in hospital at home settings, right? And in having the ability to understand what's happening in terms of the quality of care that's being administered, because it's happening outside of that traditional controlled hospital environment. And so there's resources that go into much more depth about what that looks like, what are these parameters that you can be measuring to evaluate the success of your program. When we're looking at building a tech stack for hospital at home, when we're looking at implementing in and integrating new hospital at home based workflows into existing clinical workflows. At DiMe, we recognize that from a technology maturity perspective, everything that we need to build successful hospital at home programs, they exist. And so what we did with these resources is really bring together a blueprint of what that looks like, and from an operational perspective, from a patient experience perspective, what do you need to consider? What is critical to building such programs? So I encourage everyone watching to go check out the resources. And when you do, if you've got questions, feel free to reach out to anybody at Team DiMe to get more information.